I want to start to give people a little bit of context of why we've invited you. Okay. And tell us a little bit about your journey. How did you become a pain patient? I understand it was it's kind of a banal workplace accident that started this all off.
That's right. Well, and thanks, I want to say thank you for having me here today. This is quite a privilege to be here and to share. So my journey was from an accident and would end off meaning that I had to have a shoulder surgery. So the shoulder surgery was just supposed to be a minor shoulder surgery. Everything was supposed to be okay afterwards, back to work in 6 weeks, and then that would be it. That's not how it went. I was left with this severe back pain. I ended up being diagnosed with myofascial pain, but what happened when I got left with this pain is that because it was odd, and the shoulder was okay, and I was constantly told the shoulder's okay, the surgery went well, that nobody could diagnose this. So I spent years going from clinician to healthcare provider, from private to public, everything, trying to find answers, with them all offering the same solutions, which were all wrong. And within that, the more you bounce around and their treatments don't work, then you're dismissed and you're not believed and you're getting the eye rolls and everything else. So for years I was not at work, I was not a functioning member of society, and it took probably about 2.5 years before someone had that light bulb moment and said, we'll send you to the QE2, to the local here pain specialist. And that's what changed my life, but it took a lot longer for recovery.
And a couple of things came to mind when we discussed this earlier, preparing. First of all, your story is kind of a reminder that we can all from one day to the next become a patient, right? A lifelong patient. The other one is that sometimes we have odd definitions of success. You had successful surgery.
And I kept hearing that over and over for years. Well, I couldn't get back to work, where I couldn't get off the couch, where I was in massive pain, and off then being anxiety and depression and over-medicating, yeah, but it was successful surgery. Yeah.
So the pain, the depression, the inability to work, all that stuff you got care for. Now you got some in the public sector, some in the private sector. Yeah. Tell me about surgery. Obviously you got in the public sector. You don't have private clinics in Nova Scotia. No, but yeah. How do you figure out the rest? The physio, the massage, I'm not sure, the pharmacy, some drugs are covered, some aren't.
Right. Oh, initially, I did get all these services, pharmacy, osteopath, massage, psychologist, but they all initially for the first couple of years said, you're fine, there's nothing wrong. And it wasn't until I got into the pain clinic that they said, oh, well, maybe not. We have different treatments for you, there's other stuff, but for me, that meant a 3-hour commute in order to get these. And it was until there that someone actually knew what chronic pain was and was able to. And so that then is when things change. But that's years later, yeah.
Yeah, so we'll come back to the pain clinic. But in the interim, a lot of your stuff was covered by your employee benefits.
A lot of it was. Yeah.
But those maxed out pretty quickly.
They maxed out, and then I had to start paying out of pocket. And it was a workplace injury, so a lot was covered by them. And then I had some other, but it maxed out. And then I had to pay a lot out of my own pocket, a lot. I was still a lot on my own, because even with workplace injuries, they may not acknowledge that an osteopath is what they consider care, you know, or certain physical therapists, they don't consider care. So you're paying out of your own pocket. You're desperate to find something that's going to help you. So yeah, I spent a lot more than that $1,000 that they spent a year, thousands.
And a lot of Canadians are fairly naive about this. They just think we have Medicare, doesn't matter what goes wrong. When did the shock hit you?
Probably within the first couple of months after the surgery, and I wasn't getting back to work. And it started becoming very clear that something was going wrong. I don't know if I knew how wrong it was going. It's just I was becoming so depressed and so much anxiety and so much. Everybody could just give you prescriptions. Just medication after medication, so you do what you have to do. You mix things up, and probably didn't do things the best way I should have, but I was desperate. Yeah.
And you're desperate. Do you think about, well, this is private, this is bad, or this is public, this is good? Or
it was all bad.
It was all bad.
But I didn't know it was bad. I didn't know that. As I knew they weren't offering me anything. I didn't know it bad until I started getting the eye rolls and I started getting the disbelief and I started getting like, gosh, is it really that bad? I'll go back to work. And you go back to work and you last 3 hours. So I didn't know what they were doing with bed because I didn't know what was wrong with me and they didn't. They didn't know what chronic pain was. And this is a big issue with whatever system. If they don't know what the illness is, how can they help you? How can you help yourself if you don't, there's no way. And they don't know. There's a huge lack of knowledge.
Yeah, and with chronic pain, it's particularly difficult. It's often difficult to do a diagnosis. It's complex.
It's complex, and that becomes the problem, yeah.
Now, I want to go back to the people often hear, oh, I go to private because they're nicer, right? They think more about the patient. Was the private care better? Was the public care better? Were there differences?
No, just one way. Initially, they were all nice. It was after the first couple of months and the treatments aren't working and then they're not believing you. And initially they'll all take your money too, but then they stop believing you and then having that other insurance company held over and then they're pushing you back to work and it's not working. So you're then thought, you're making it up. You're a woman, you're anxious, so they stop.
Pain's all in your head.
Pain is all in your head, and that's what they do. They stop, believing you. So for me, it was devastating, and the sad part is that's 10 years ago. This is still happening, So I had to open up a network of a pain network of support groups and education for people because people are struggling. And we need to do something for them to struggle, to stop the struggle, stop the suffering.
And that was ultimately your response, was become an advocate.
That was my response to become after years. Now, it took me probably 4 or 5 years I got back to work before I did because you don't want to tell someone you're living with chronic pain because take a pill and it's gone. And that's the problem too because there's such a lack of knowledge about it. You don't want to say it. So probably about 4 or 5 years afterwards, I thought I'm going to because people were still suffering. So I started sharing, I live with this, and started being an advocate and saying we need service, we need care. And it was right about then that we opened this very unique pain network and over the years have partnered with Pain Canada and are offering education for people about what pain. People on the ground floor, people in our communities, they don't have to make that 3-hour commute, to do this on a shoestring budget. And people they're making a difference. We're making a difference. And I don't know why other people aren't making a difference when we can do this on a shoestring budget and partner with other national organizations to offer something that's very valuable within our communities.
And advocacy is a really important part of our system that we take for granted. You don't get government support as they do, say, in European countries. There's a lot of support for advocacy groups.
That I didn't know. No.
Well, I don't want you to move because I told you that.
No, that I didn't know. No, you get no support. You get no support. Our organization is run 100% on volunteerism, with the odd donation we'll get here and there, which is very odd, just to keep things sustainable. And we're the ones who are making an impact in our communities. For me, there's no support for what I do. No, and I don't even know if there's a lot of respect for what I do. I don't know if people get what we're doing and the impact of putting yourself out there. This is what I live with. This is what's happened to us. And but it's the only way we're going to really get the reality of what is happening to people, and people are struggling.
Yeah, I think anyone who's been a regular patient appreciates advocacy groups because they come to understand how important they are. We have some great advocates in the audience. I know Sharon Batt is here, a really great advocate for affordable drugs, for example. And they're really key elements in changing the system. I want to talk to you about another part of advocacy, though. People say, don't go in the system without an advocate. That individual part, can you speak to that a bit, having someone there to defend you?
I think it's huge. I think it's huge. If you could have someone go into the system with you, and I know as a chronic pain patient, we know how to navigate the system after a while, and I think it's huge to hear what's happening, to get your points out there, to ask questions, to walk away with information instead of just walking out that door. And many times I've drove from Halifax back to the Valley in tears and crying for hours. So yeah, if you have someone who can go there and help you out and stand by you, yeah. And then we become that person who lives with chronic illness. So now if you can have someone come all the time with you, you know, until you get stronger, that takes a while. It doesn't happen overnight. And you still have to live with this illness.
And as a chronic patient, you have certain expertise. You're in the system, you've been there a decade.
Yeah.
What do you want to change? What's the most urgent thing that needs to change? We have a lot of Nova Scotia health bureaucrats here. Where should they start?
Where should they start? There's a few things.
And I just have to say, I don't use bureaucrats as a dirty word. To me, we need bureaucrats. We need people who administer. I have come from a family of bureaucrats. I don't use that word negatively like some people. So I heard some oohs and ooh, some angry oohs there. So I just had to, sorry to interrupt.
That's all right. What do we change? When we talked about it here today, we talked about accessibility. But I think what we're missing when we're talking about accessibility, and I hear you talking like we need to get to your MRI or you need to get to a clinician. And that's all important, don't get me wrong. But we're missing, we also live with these illnesses. And if you get to a clinician who doesn't know what they're doing, they're setting you back. You know, we have, like in pain, we have Health Canada has action plans for pain. There's pediatrics, standards of care for pain. Why isn't everybody taking all these standards and implementing them and know what's going on? And I'm sure every disease has this. But to just get there in front of somebody is no good, or just get there for the surgery, or just get there for that's a part of it, don't get me wrong, but there's more to it. And there is that patient-centered care, that uniqueness, and that uniqueness in that teamwork and working under what we call the biopsychosocial model, working with all of it, and as a team, and within your community partners too. So there's more than just getting there.
So not just access to care, access to quality care, to appropriate care.
Yes. Yes, and it has to be appropriate care, yeah. In your community would mean, because if you can't get into your community, that's barriers. People can't be driving to the city and all the time to get care. It becomes a barrier for them.
And we want to talk about quality. Let's talk about the pain clinic. That changed your life because it's very specialized.
That's right. The pain clinic changed my life, and that's in Halifax. In the Western Zone, we don't have one. We used to have a pain clinic, but they pulled a psychologist, so we now are not, because you have to have that team. We don't have it. We do have our support group there, and actually in Nova Scotia, the demand for support groups and for our pain networks are so much. We've got 5 now. So is there, but we can't operate alone either, you know. So yeah, this clinic is special. It's unique. They offer everything. They have they talk about dietitians in there, psychologists, physio. There's where I had to come to a physio who understood chronic pain, which is a long commute when you're in a real bad state. So yeah, the specialists are wonderful. It's one of those small pockets of great care, yeah.
But I don't know the exact wait time, but it's a long time to get seen.
It was years ago, and now I think it's up to 3 or 4 or 5 years now. One time I heard 3, and another time I heard 5 years. So it's anywhere from 3 to 5 years for the wait time to see a pain specialist right now, yeah. It's massive.
That's a long time to live in pain.
That's a long time to live in pain, to be not at school, because it affects our children, to be not at work, to be non-functioning, and to be doing what you have to do to kill the pain. And we all know there's a lot of things that we do that we're not proud of, but you have to do something.
Now, I want to give the audience a chance to ask you questions. I'm sure they have some, but I want to ask you one last one, because the focus today is on the private public health care. As a patient, as an advocate, what's your feeling on this? What's the right balance between private delivery and payment, and how do we get this right?
I don't know. I think...
That's the most honest answer I've heard all day.
I don't. I think, we need everybody to get, whether it's private or public, my fear is if we go more private, are we going to deplete the public system more? I mean, I don't want to see my pain specialist go somewhere else. What's going to happen to me? I have to live with this disease, So I'm really fearful of that. I'm fearful, will the private be monitored? Is there going to be monitoring? The monitoring effectiveness? Are they going to work as teams? If we lose this biopsychosocial model where you're doing the medical and the mental and the social part of it, we're not going any further ahead. So I don't know, and I don't know how we're going to do it right. And it shouldn't have to be that we have to pay out of pocket, because the insurance company then guides our care. And we've talked about that. They're going to tell me what I can and can't have, so my care is guided. It's not patient-centered care.
Now, any questions from the audience for Virginia?
We've got a virtual.
Okay, let's fire away.
Yeah. How can we improve education for our healthcare workers to believe in their patients more?
How do you get your healthcare workers to listen to them? I don't know. I've been so often. I guess the thing is for the healthcare workers to have confidence. If your treatments aren't working, that's not on you. That's maybe just saying my treatments aren't working. There's other stuff. Let's reach out to our teams and our partners and within our communities and our clinics and talk to them. Don't think it's and maybe that's what happens. They think it's a fault of theirs. It's not. Some of these illnesses are very complex. So just listen to them and be open, saying, okay, I don't know what's happened to you, but I believe that your pain is real, or whatever's happening in your life is real, because it really impacts your whole life.
But things like empathy are important. Eye rolls are never helpful.
Eye rolls shut you down. They shut you down. You then don't trust not only that healthcare. I speak at Dalhousie and Acadia to some of the students, and I say, you may be there with us now, but you now have to build that trust that somebody else has destroyed, the trust and the hope. Yeah.
Yes, we have a question up at the front. Dr. Finley.
Hi, sort of a comment, I guess. Alan Finley, pediatric pain doc and anesthesiologist at the IWK. So we've had a true multidisciplinary pediatric pain clinic since 1995. And your last comment was particularly pointed, because I think sometimes the most valuable thing we do is when a child, teenager usually, but some younger, come in with their parent or parents. We have a physician, an advanced practice nurse, a clinical psychologist, and a physiotherapist all sitting around the table hearing the story and listening to it and believing it. And sometimes I think that's the most important thing we do. We try and walk the walk. It's not a physician clinic. It's not my clinic or my colleague's clinic. It's a team clinic. And, I sometimes say I'm the least important person on the team, because the other 3 members do most of the legwork. The lack of that kind of integrated care throughout the system is a major problem. The lack of access to knowledgeable psychology and physiotherapy and physicians working together as a team in the community has been, to be honest, I think that's what's fueled the so-called opioid crisis, is because if you're a family doctor in a small community and you've got 20 patients in your waiting room and somebody crying on your desk, and all you have is an opioid prescription to give them, no psychologist or physiotherapist to send them to, and they can't afford it even if there was one, what are you supposed to do in the 6.5 minutes you have with the patient? And so it's a systems issue.
Yeah.
It's not a drug issue. It's not a physician care issue. It's a systems issue. So that plays into this question of, psychologists, physiotherapists in the community are private. If you're lucky, you have insurance that pays for some of it, but many people don't have that. So how do we fix that? How do we separate the perspective from just being, oh, doctors know everything, from recognizing that we don't, and that we need to work with team in an integrated fashion, not just in a, oh, go see the other clinician. How do we work together and get paid for it so we can eat more than craft dinner, and make that system work?
Thanks for that insight and speaking to the value of teamwork. Did you want to reply at all?
Yeah, I think, Dr. Finley, he's spot on. We all have to work together, but it's our clinicians, our physio, it's everybody, and it's our community-based organizations. We all have to work together, or we're not going to get anywhere. And we just, and the people paying that, we just redid our website and put on a comment section. I might have to take it down because I can't be getting these comments all the time. People are struggling. I can't. That's not what I do. We're an educated peer support, and yeah, we've got to work together. We need to do something.
Any other questions? Yeah, over there. Yeah, right in front of you. Yeah.
Hi, my name's Heather Spidell. I'm here as a mom, and I'm here as a daughter. And Virginia, I have to say hats off to you. You're struggling with something that's very real and trying to be seen and heard, but you're also helping other people by raising your voice, so thank you for that. I'm very interested in the topic of pain, but more so around mental health and mental illness. And as you talk about pain, it reminds me of the unseen crisis that we are facing around mental illness right now. We have the highest rates of poverty in this province. We also, our numbers of suicide have gone up every year. 155 souls lost their lives last year in Nova Scotia. My nephew died 2 years ago and left behind 3 young children. He died by suicide. 3 months later, he got a call for a psychiatrist appointment. My daughter struggles with mental illness, and I have had to seek the support of private resources in Ontario because the wait times are 3 years here. And I've worked in government, and I completely understand some of the boundaries and barriers. But your point and Alan's point about an integrated system where we see the whole person, apps are not going to help someone who struggles with mental illness and eating disorder and pain. They have to be seen by someone, and they have to be followed. They also can't be prescribed anxiety meds when the personality disorder that they have has amongst the highest rates of suicide. And not be followed when they're prescribed meds afterwards. So I think there is a space for private health care. I don't know what it looks like. I don't know what the solution is. But right now, out of desperation, many people are seeking it. I don't have the money. My family doesn't have the money, but we do what we do because we love the people in our lives. And so, again, I just say hats off to you for raising your voice. I think we need more people to be brave enough to do that. I think we're a tiny province here, and we don't get the Globe and Mail anymore.
I knew that was going to come up.
Had to come up, had to be said, had to be said. But Andre, your voice and your advocacy through the Globe and Mail is much appreciated. And thanks for the opportunity to chat.
Well, thank you for that comment. You can get the Globe and Mail online, but it'd be nice to have the paper here, that's for sure. Any final word, Virginia, to build on that very important?
Yeah, I think a lot of it is said today. We have to work together. And, you know, we talk about mental health and we talk about all these things, but if your illness is not taken care of, you're going to have another one and another one and another one, and things are going to combine. Your pain's going to become mental health. Everything's going to be one after another, and people are struggling. And we need to remember, people are living with this stuff. It's not a one kick at the can and they're out your door. But these conversations are important, and these are going to make us together, I hope, some changes.
Well, and let me end then in saying 2 things. One, I'm very sorry for a chronic pain patient to have to sit on this uncomfortable chair, but thank you for doing it. And thank you especially for sharing your views. I think it was very insightful for the audience. And please join me in thanking Virginia for being here. Thanks.
Thank you. Thank you, André. It's a pleasure to meet you, and congratulations on your